Hello and welcome to the Work for Change podcast. This is episode number 78 of the Work for Change podcast. As you guys can tell, I am not joined with my brother Jean, spelled like Jean. My name is John with a silent H. I'm so glad that you guys are here. So like I said, we are episode number 70. I was actually looking at my phone to make sure that was correct. So today we have a really cool interview. So I was actually able to interview Dr. CJ DePalma, who is actually the person that is helping me right now with my back injury. And so he's helping me rehab. He does a lot of physical therapy. I mean, that's what he does. And I really like his philosophy when it comes to pain, dealing with rehab, rehabbing an injury. I think that this can be a really interesting episode. I would say that for anybody really, but like anybody that has dealt with pain in the past, whether it's an injury from working out or just moving around, I would say that pretty much everyone on the planet is going to be injured at some point. And, a lot of those end up being like back injuries, shoulder injuries, things that are related to working out, fitness, but then also just kind of related to being a human and dealing with injuries. So I really thought this was a cool conversation, selfishly for me, because he is a person that's helping me. So I was able to ask some questions that I genuinely had. But then stuff that I think is really helpful for someone out there that might be injured right now. You might feel like life is over. You might feel like it's the end of the world. You might feel like, man, I don't have any options. I just need to sit and wait. I would really implore you to listen to this whole episode, because that's kind of what it's all about. You don't need to just wait around and wait for your pain to go away. You can continue to move through it. You can continue, to try and better yourself through it and not just wait for the pain to go away. And so with that being said, make sure you guys do check out CJ. Everything will be linked down in the description if you're watching on YouTube, obviously the show notes if you're listening anywhere else. And then make sure you follow us on Instagram. So the Instagram is Work for Change Podcast. I'll make sure that I post a picture so you guys can kind of talk. I'm sure CJ will be down in the comments on that post so you guys could ask him some questions. Seriously, I really think this is going to be a helpful episode for anyone out there that's struggling. So again, thank you guys so much for tuning in, and let's get into the interview. All right, CJ, thank you so much for coming on the podcast. I'm obviously super excited to talk because you've been helping me quite a bit with everything that I'm going through right now with the whole back issues. So I'm just excited because you're the person that I'm working with that's kind of helping me through this. And obviously we've had conversations, and I really like kind of your philosophy through what you believe with injuries and how to rehab them. So we'll kind of get into that, but if you could just kind of, explain how you got into, what you're doing now and what exactly it is that you kind of do now, that would be awesome.
Sure. Yeah. So my name is Dr. CJ DePalma. I'm a physical therapist. I've been out of school for 3 years. I own a clinic in Pensacola, Florida, cash pay clinic called the Movement Doctor. And I also work with WOD Prep, and I run the one-on-one coaching division there. And that's how we met through WOD Prep. So through that, we do performance and rehab. We have a couple other coaches on staff, as well as another physical therapist, and we work remotely with athletes all over the world. We have athletes in Australia, Brazil, Germany, California, all up and down the East Coast. And do you have any athletes in Canada? I don't think so. Not active, not currently. But yeah, so we work with them from performance to rehab and everything in between. We've had athletes at the games that we've trained there, or that we've coached all the way there. We have athletes post-surgical and everything in between. And so that's kind of what I do with WOD Prep, and that's like the primary focus of my my business, I suppose. But as far as kind of getting to that point, so I started creating content for Ben maybe 2.5 years ago. And then it just kind of evolved into working with injured athletes. And then some of those injured athletes were high-level masters athletes that were going to the games, and I was working with them. And then it just kind of, I've always coached a little bit of CrossFit since I started, really. And so as far as like my clinical focuses go, I am a big advocate of a movement and mindset driven approach. This isn't a very, people hear mindset and they think holistic. I'm not holistic whatsoever. I'm very much science driven in the sense of like, you know, everything that I do is very much backed with evidence and research. And so with that, you know, you follow people that are much smarter than you, and you listen to what they say, and you follow the research, and the research shows that this, you know, these belief patterns and pain is just much different than what it was. So that's kind of created this like movement and educational driven approach that I have with my patients that really relays well into performance too. So
yeah.
I think we'll say that's a very short way.
Yeah.
So what I do.
When the way that we got connected was Ben through Wad Prep, if you guys have listened to the podcast before, he's actually been, I think he's the only person that's been on twice. So Ben reached out to me and he was basically like, hey, my friend CJ works with me. He's great. I think that you should work with him. And I trust Ben very much. And I was like, okay, yeah, great. Like I was obviously, and this was like right after I posted the picture where I said like, yo, I hurt myself. And so then like for me, personally, like it was just nice having someone to speak to that you obviously know what you're talking about, right? Like I've been very, very lucky that I've never had, like this is by far the worst injury I've ever dealt with since I started working out. And so I did not know what I should do. You know, I've had little things that we've talked about little, like I've had little tweaks to where I would just kind of rest for a couple days and I was fine, but nothing to where it's like, this is going to be a process. Right. So when I first kind of like hurt my back, and I guess I could kind of explain what happened just so if people don't know, I was doing a workout outside. I did something. I was doing a devil's press. I felt my back right away, dropped the dumbbells, and I was like, something's wrong, right? And then so maybe a couple hours after that is when I got linked up with CJ. And the thing that like for me, what I initially was like, what I should do is like I should not move as much as possible and be as still as humanly possible, right? Because for me, I don't want to feel pain, and I think that that's kind of where I wanted this conversation to go, and like what you believe about pain and the like your philosophy with it, because I when I take a step back and I've heard you talk about it, it makes complete sense. And I think that there's a lot of misinformation out there for people that you just don't know, right? Like if you're not injured, you're probably not seeking out this information unless you're doing what you do, which is you're a doctor in this stuff, right? But like if you're not injured, you're like, yeah, pain, I want to avoid it. But when you are rehabbing through, and that's kind of, obviously what we're doing now with me and you is like, I'm rehabbing through this pain that I have to try and get better. And so I would love, I know I said a lot of words, but if you could kind of like explain the philosophy of like how you help someone, right? Like, I mean, it would be great. Like how you help someone that goes from me, our first conversation, to how do you get them back to feeling better and feeling like they can feel confident? Cause like for me right now, I've been thinking about it, like I feel like it's going to be a while until I'm confident under a barbell again, or confident doing a devil's press or whatever it might be. And so like, I'm just genuinely curious about how you are going to take me, because I'm one of your clients, right? From where I'm at right now to hopefully squatting heavyweight again,
Yeah. Sooner rather than later, for sure.
Hopefully.
But yeah. All right. 10 seconds. Ready to go. Yeah. So that's a big question, right? And it's very specific to person, but the biggest thing that we want to kind of relay initially is that pain has been, so we're gonna try not to make this too long, we'll try and stay as focused as I can. So in school,
no man, you can ramble all you want, bro.
Cool. So we'll try and stay focused, and I'll try and stay on it. So pain has been taught to us over the years as this direct relationship to tissue damage. And I'm going to read you the definition of pain through the IASP, which is the International Association for the Study of Pain. Okay. And make sure I read it specifically. And this was made in, let's see, I think in the 80s. Where's the definition? I know, but I just want to say it right. Here we go. All right. So the definition of pain, through this main group, right? And this is like the group, is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Okay. And we're going to talk about like what that means, because that's a lot of, very convoluted statement. So we're taught initially, and everyone believes that if you have pain, you directly have something wrong in the tissue in your body, right? So a muscle tear, a muscle pull, a strain, broken bone, etc. And that's very accurate, right? If you have those things, you are likely going to have pain acutely, right? But what we've learned, and we've learned this through lots of MRIs and lots of double-blind studies and things that, we talked about it on our call, that some people have a disc bulge and they never know, right? And how can that be possible? So I have, if you guys know anything, so I have 2 torn labrums, right? Which is like the suction cup of the shoulder. All right, kind of holds the shoulder in place, gives a bone kind of like this, airtight seal of how it moves, right? Both mine are torn, and they've been torn for a while now. And so, but I don't have any pain. I did for a long time. I made a lot of bad decisions, and I trained like didn't train very smart, trained very ego driven. And, I was at a really, really good gym, and I wanted to keep up, and it just didn't work. So, but the labrum doesn't heal, right? It doesn't grow back. It doesn't reseal. And so how can I be in pain, or how can I not be in pain if it's still damaged to the same extent as what it was? Some people will say scar tissue, maybe, right? Others will say, well, maybe it wasn't torn, or the best one is I got used to the pain. I got used to that's my like my favorite is like, oh, so you just like the way that you respond to pain has just changed over the years, right? And you set yourself up for this, like you're not giving yourself enough credit, right? People are like, oh, I've been used to this for forever now, so it just doesn't hurt anymore. And it's like, no, it just doesn't hurt anymore. It's not because like your pain responses are just like all of a sudden you're like Iron Man.
That's
like
I was
it just
gonna say.
doesn't.
It sounds like a superhero, like like a,
right, yeah. So
it doesn't. I mean?
Like
yeah,
it doesn't,
you cut my arm off, but now I don't feel any pain. It's still gone, but I I got used to it.
Right, yeah, exactly. Like the pain is still there, but it's no. Your body adapts, and we adapt to what it is, and so based on the definition is basically an unpleasant sensory or emotional experience. Now, based on that right there, right? So we have someone punch us in the face, right? Well, if you've never been punched in the face before, you're going to respond much different than, I don't know, the MMA the cowboy, right? He gets punched in the face all the time, and he probably doesn't feel a thing. But if we were to measure the force, the damage created from the punch, we could mimic it person to person, and we could measure it from a physical implication standpoint. And if we MRI'd the brain as it was happening, the brain would be doing different things in every person because their experience, their belief patterns, and their prior histories, and their emotional response plays a role in the severity of pain. So if you are scared, your pain will be much higher. Pain is, at its most basic concept, is a threat response to a situation. Okay. So sensory and emotional experience associated with actual or potential tissue damage. So tissue damage is still there. That's the biological part of it. Okay. An unpleasant sensory or emotional experience. That's the psychological part of pain. So we have biological and psychological. And then we have the last, or described in terms of such damage, meaning that the social influence of people telling you what's wrong will drive your pain response as well. So it was called the mechanical model, meaning tissue dysfunction directly and linearly correlated with pain. We've learned that that's not very true at all. Very, very small amount of correlation between amount of tissue damage and amount of pain. But now we have what's called the biopsychosocial model, meaning we have these 3 tiered factors of biological tissue damage, psychological beliefs, social, and these outside influences creating this belief response that influence our pain. So we call it the biopsychosocial model. Okay? And what that means is that pain is multifactorial. Your pain is always real. And the biggest argument I get is like, so you're saying pain's in my head. No, this isn't like some like phantom thing. Pain is always in the brain. Pain is a response. right? So you have to basically have a sensory input. It goes up through into the control center, and then a response is created back to that area. So this whole area up here, right, this flow assesses the input, and all of those factors that we're talking about and many more play a role in your response, So that's really important to understand. Now, again, I want to reiterate, I'm not saying pain is fake. I'm not saying pain is not real. I'm not saying that pain is in your head or you're some, like you're some psych that has mental issues. No, all pain comes from the brain, and it's just more things create that pain response than just the amount of tissue damage or lack thereof. Here we go. So here's a great example. Ben loves this example too. He uses it every time we talk on the call with anybody. He's like, so have you ever stepped on a Lego?
Yes.
Right. It's the worst, right? You look down and you're like, I want to cut my foot off, and you want to say all the curse words on the planet, right? And then you look down and you're just like, oh, it's just a Lego. And then in 14 seconds, it's zero pain whatsoever. But that initial pain was like legit getting stabbed in the foot, right? Knife through, stitches, glass, right? But it goes away so fast. So that's an example of a sensory response that is not very correlated with tissue damage, or something as small as like a paper cut. How bad does a paper cut hurt? So bad. But it's so small, right?
Or like when like the skin on your fingernail starts coming up or something, like when you
it's the worst. Don't even talk about that. What's wrong with you?
So the thing that I like start thinking of when you're explaining this, and like the thing I remember, like kind of, I think like learning when I was a kid, was like pain is your body's way of protecting you, right? And like they would always use the example of, if you put your hand on the stove, it's gonna hurt, because if you kept it there, then you're gonna really mess up your hand, right? And so I think for me, the reason why so hearing that, I'm like, okay, so if I ever feel any pain in my body whatsoever, I need to avoid that at all costs.
Correct.
Right. And so that, I think that's where my mindset is when if I have something that's going on in my body, right? Like, if it's an outside thing that I can see, I'm like, oh, I cut my hand. Okay. Like, I get it. But if it's like my back, right, I don't know what exactly is going on. So like for me, I'm like, my initial thought, and what we've been working on to kind of change that, is if I feel anything, I should stop doing that and never do that again until there's no pain associated with that, right? And so that's what I think is a really interesting thing, that you've been genuinely like helping me not think that way and just kind of see it in a different way.
Yeah. So we talked about it, and a lot of people say there's two things you can't avoid in life, and that's taxes and death, right? And I'll say there's a third, and it's pain. Not saying you have to be in pain, but everyone will experience it. And pain has been demonized as this thing that is exceptionally bad all the time. Now, pain keeps you alive. If none of us felt pain, we would die. It's a condition. People have it and they die in their 20s, right? They just do. Like they don't last that long in life. And usually it's due to like, they end up getting like a foot sore and they don't feel it and they get infected, right? And it's pretty much, so feeling pain is very important. It's very important, but we've basically ostracized it to the point of any pain at all means something is wrong. And sometimes it's not. Like there's just so many cases like low back pain, right? So had we not intervened and had we not been working together, the likelihood of it absolving on its own without doing anything drastic or having any medical intervention is 4 to 6 weeks, like 95% guaranteed, right? Like the numbers are drastic. Everyone, like 4 out of 5 people, or 9 out of 10 will experience back pain at some point in their life, right? And like 1 out of 10 will experience like severe back pain in their life, but not to the point of needing surgery. And then it's like 0.1% of all back pain in general will be something that needs to be surgically intervened. And you'll know when it is because you'll have numbness, you'll have marked atrophy, you'll have marked weakness, and you'll have unremitting 10 out of 10 pain for a long period of time, right? And so what happens is we get like those episodes that people are pretty painful and it's been sticking around for a long time, and they can't figure out what's going on and why the pain won't go away, but they're not doing anything. And then every time they move, it gets worse. And I compare it to like the perfect man, David, right? Like the guy, he's out like this and his feet are right. So the drawing. So I call it like the movement bubble, right? And for those that are like new into fitness, when you start doing anything, especially like overhead is a great example, it's just super uncomfortable and it hurts, right? But it's not dangerous. Your body just doesn't know how to respond to that stimulus yet. And so with graded exposure, we slowly, and when it comes to just doing general fitness, people don't freak out about it. But with pain, basically once we're in pain, I would like our movement bubble like starts to close in, right? Because we're not doing anything, and then everything hurts, right? And then it's like, oh, I got a bulged disc. And it's like, well, maybe, but so does probably 90% of the population that's 60 years old and 60% of the population that's 45, but not everyone hurts, right? So we don't worry too much about the specifics, right? We just start to move again. But pain has been just purely demonized as any pain at all needs to be treated or needs to be avoided whatsoever. And I'm not saying that this is definitely not a no pain, no gain type of thing, right? But we just need to paint a different picture about what pain is telling us a lot of the time. And sometimes, since pain has all of these outside influences, our pain response can be altered and be too severe for something very minimal. Like if you're very fearful of whatever it is. So I'll tell you a story, right? So you've heard TED Talk, right? I assume. And everyone here is, right? So there's this pain scientist talking and talked about a situation he was in. And he's running in his hometown in the woods on a trail, and he's just going about his day, taking a nice jog, and he brushes up against the bush and wakes up in the hospital 6 months later. And he was bitten by a snake, venomous snake, and almost died, right? Life flighted out, et cetera, was in a coma, had to like regain the ability to walk and all of this stuff over like a couple of years. And so he's back to full health a few years later, and he's running his hometown in the woods again. And wouldn't you know it, snake gets up and gets him again. And he looks down, he drops down in writhing pain, and he looks down and he brushed up against the bush. So his response had changed so much. The first time he didn't think anything of it because he thought he brushed up against the bush, but he got bit by a snake, right? The second time he brushed up against the bush, but his body responded due to his past experiences exceptionally higher, right? So there's just so many factors in it, and pain is very important, but it shouldn't be feared, right? And your fear of like, I have shoulder pain, I shouldn't put my arm over my head. Like, people are like, oh, it's my favorite. I got knee pain, and they go to the doctor and they're like, well, you just shouldn't squat ever again. It's like, well, how am I supposed to go to the bathroom? How am I supposed to get on a toilet? You know what I mean? Or like, don't pick up 10 pounds because your back hurts. What? My dog weighs 100 pounds. I like to pick him up. You know what I mean? Like, gallon of milk weighs 8 pounds.
Yeah.
It's like, what am I supposed to do? Right. So we just shouldn't be so fearful of it. It's important and we should address it, but we should have a different thought process about it when it occurs.
Yeah. And I think that something that you said early on right there I think it was encouraging to me. And like hearing you say how like the amount of people that actually need to get surgery because of like back pain is very, very low. And like for me, my like when I first, felt that pain in my back, I'm like, it's just how I am. I'm not sure if you know anything about Enneagram, but I'm an Enneagram type 6, which the whole thing about that, it's like a personality thing. My whole thing is I worry. I'm a worrier. That's just how I am. And so I felt that and I'm like, oh, well, I need to go get surgery. Like this is like, I'm going to, like, I'm not going to be able to walk. Like, yeah, it's just, that's where my mind goes. Right. And then, so that influences like what you were saying, it influences how much pain I'm in. Like, obviously there is pain, like you were saying, like there is definitely pain that is happening. Like I'm feeling it, but I know for a fact, some of that is being amplified because I am so worried and I am like freaking out about all of this stuff. And so like hearing that, it's like, hey, you might have a back injury, or like those statistics of the amount of people that actually do have like back injuries that don't even know that they have them. I think that that's really important, and like it can be really helpful for people that might, be experiencing it and be kind of worried about having that.
Yeah, it's and I think it's really, and that's like the message I want to get across is we want to empower people to like not be fearful of pain. I'm not saying like go outside and like, break your leg, and stare at it and like yell at it like you're, I don't know.
No
like,
pain, no pain.
Yeah, I got this, mm-hmm. Right? I mean, that's not it. But a lot of it can just be very well managed with some simple like activity modifications, right? If it hurts so we'll talk about your case. It's a great example. It's one that a lot of people experience, and there were some people like on the YouTube page that were like, oh, you just can't stop working out. And it's like, well, you're working out and what you're doing right now is completely different, right?
Oh
like, it's
man,
just active.
That was so annoying. Like, cause I knew, so that's the problem that I have with everything in general is like, not with everything, but like with sharing things in general is I know that people are going to have their opinion on it. I get that. And I've come to terms with like, not everyone is going to 100% agree. I am very lucky that my following is very cool. They're very understanding and they're usually on the same page as me. But I knew for a fact when I was sharing what I was doing to rehab, people were like, you just can't stop working out. You have a problem, blah, blah, blah. And I'm like you were just saying, and I'm sorry I cut you off, but it's like what you're watching me do right now for this rehab compared to what I do when I work out, it's like 5% of what I'm doing. Yeah. Like maybe not even that much, And so sorry, but yeah, I was just like, I was like, do you just want me to lay on the ground and wait for my back to magically heal? Is that like what you want me to do?
That's actually what they said. They said to take NSAIDs and just rest for 3 weeks. And I was like, wow, that's a very specific prescription. So like, why do we address it like this? Right. And, is rest appropriate? Most of the time, like we're talking like Netflix and Cheeto rest, probably not. Right. Cheetos sound pretty good, right? No, just kidding. Yeah, can't say that on the podcast. I was like focused. Is it appropriate? Sometimes for sure. Right. But not for an extended time ever, like what you're doing what I would consider to be just getting blood flowing, right? And for you, we consider you like movement averted, meaning like you have this positional aversion, like you have this movement pattern that you want to, your body is like, let's stay away from. So instead of avoiding it, I like to slowly start working into it. And that's what I've seen work the best. And I'm not saying, like we tried a standing Jefferson curl yesterday and you were like, whole big negative. Great. So we know that that's too much. So what do? So we step down the ladder to like what the movement is next, right? When we like during our call, right? You had we call it a shift, and you were shifted. And even on the call, just like working to standing up straight, we got you moving straighter. We weren't, and I mean, to some people that's an exercise and working out, and it's just the reason we do it is one. We have a lot of factors that are playing into your pain response right now. And one of them is fear. Well, if we can reduce the fear by just doing a little bit of something, then we improve confidence and then we have a good hormonal response, right? Right. We reduce cortisol, we improve endorphin production, right? So right there, we already know that hormones play a big role in inflammatory responses and cytokines and all of these things, right? A lot of people hear the word cytokines right now because of COVID, but this is basically inflammation. And when we stop moving, the body will produce a lot of it, right? And so we move and it helps move around blood and inflammation and fluid and things like that. And it creates a positive response in the body. The body is a very fluid thing and it needs to move. It doesn't do very well. So like the greatest example is like try to stand still and not move for 3 hours, and just don't move your feet. Like if you could just stand there and this is anyone, or just 20 minutes, right? And 3 hours is probably aggressive, but it proves the point. Just 20 minutes, just don't move, standing up straight for 20 minutes and tell me how uncomfortable you feel. But just go walk for 20 minutes and you feel fine.
Yeah.
Totally okay. Right. 4 minutes and you see me I'm standing right now. So I'm like moving my knees and like I'm on like a cushion pad. And it's just, I hate it. Right. And, so like lying down or sitting for that period of time, while it might at that point not be producing pain, as soon as you get up, you're going to feel terrible.
Yeah. And so
terrible, right?
Something that you said that really resonates with me when you were talking about the whole leaning thing and like kind of getting myself to get it into a straight position. Before our call, before we talked, I think it was 3 days ago, I was like, well, I just can't stand up straight. So I didn't even try, because like when I would try and shift my body, it hurt too much, right? That's kind of what I would tell myself. And then having that conversation, having you not make me, but like be like, hey, let's try and stand a little bit more straight. And obviously I trust you, right? So I'm like, okay, well, it's going to hurt, but obviously he knows what he's doing. So now, a few days removed from that, pretty much every time that I stand up, I kind of have to do that shift. I have to get my hips straight. It's like my body wants to be bent over. Mm-hmm. And at first I was like, okay, here we go. We're going to do this. Now I'm just like, okay, I'm going to get up and I'm going to have to, okay. And then I move along with my day. Sure. And so that's been like 100%. I can relate to that, because that's how it's been for me, like without a doubt.
Yeah. And again, there's different schools of thought, and the best thing about rehab and the worst thing, right? It's a double-edged sword of like, everyone's like, my way works the best. Well, people just get better.
Yeah.
They just get better. Does, I'm not saying this is the only way. Yeah. This is what the body does. We don't heal. I don't heal anyone, right? I'm 3,000 miles away from you, right? I haven't done anything to you, right? Except giving you a little bit of knowledge, and the body is going to do what it's going to do. We can just help it along the way. Right. And that's really important to understand. That's why a lot of methods work, right? Someone could be doing the exact opposite of what I'm telling you to do, and it would probably be okay. I mean, if you're just sitting there lying down, you're probably not going to be okay. But, I try to be a little politically neutral of like things like that, because a lot of different methods and schools of thought and different certifications and different practices, styles, and things like that work. Why? Not because all of them are the perfect prescription or the right thing to do, really. It's because the body just gets better. And we call that that concept of like, so I did something to you and you got better, which means that your improvement is directly related to me. We call that a post hoc fallacy, meaning basically that like your improvement is directly related to me. And the issue with that is that means that we have just put you in a vacuum, and the only thing of your whole life that was happening was the exercise that I just gave you. And we know that's not true. It just doesn't work like that. We have a lot of other
completely relate to that. That's how it is a lot. It happens a lot with like weight loss coaches, right? Mm-hmm. I cannot stand when people post like their client's success and they kind of make it look like, oh, look what I did for them. It's like, no, you might have given them like the most
how you guided them.
Yeah. The most you gave them was knowledge that they had to implement, right? Like I'm not going to, if I quote unquote helped someone lose weight. Like when people message me like, you're the reason I lost 100 pounds. I'm like, no, I'm not. I'm not the reason you lost. You did it all. Like I might've given you some information and like you said, given you some confidence, but it's like, you could give me all of these exercises that you're giving me and I could be like, oh yeah, I'll do those. And then I don't do them. You know what I mean? So it's like, it's all about implementing the actual, the exercises or the routine for losing weight or whatever. So I think that's really important, because the reason, and this is my own opinion, so I don't want to put words in your mouth, but usually what I've noticed is the reason that people do that and they take advantage or they take ownership of that is because it can make you more money. Like you can be like everything, like, look what I did. Market. Right. But come to me. To me. And so you stating that, being like, yo, I mean, there's other ways that things work. Like, and I agree with that as well. But like, this is what's working for me. And so like, that's why I wanted to share it with the people that are, listening and understand why I might be doing these movements or exercises. They're like, well, he just hurt his back. Like, why is he doing that?
Right. Yeah. Well, I mean, my way's obviously the best, but yeah, I understand what you're saying. It's fine. But no, and it's just a big, it really is a huge issue in rehab. And I won't tangent on it, but to believe that like we are healers and like we influence someone's response that much to the point of like they would not have gotten better without us is garbage, right? And it's the same thing with like mainly more with people that do a lot of manual work and dry needling or acupuncture or like Graston or like some of these hands-on approaches. And people walk out and like, oh, I feel so much better. There's so many other factors that played a role into like thinking that you just created tissue change below the skin, which we know that can't happen like that. It just there's not enough force, there's not enough, the biomechanics don't add up, and the actual mechanical allowance of the body would be, we would explode every time we like fell over, right? Like if we could change things that willingly would, like, everyone's like, oh, well, I have, trigger points and this person got it out with a tool. And it's like, well, you just sat for the last 30 years and your butt didn't turn into a pancake. So it's probably not that possible. But anyway, so we won't tangent out on that.
Well,
but
I think that, with that, like a lot of that it's like the placebo effect is like, if you think this thing is working, it's real. Going to definitely probably help, right? Like, so that's why when people ask about like, oh, I was taking this supplement and I really felt like it helped me. And I'm not going to say stop taking that. It's bad for you. Like most supplements aren't going to hurt you, but it's like, for me, what I say is like, I don't think that it's necessary, Right. If you truly think it helps you and you feel better taking it, go for it, Right. So it's funny because a lot of these concepts go hand in hand with a lot of other stuff in like fitness and wellness and weight loss and stuff like that.
For sure. Yeah. And like I think my overall biggest viewpoint of like things like that is like, is this a reliant and independent mindset. If you are 100% reliant on something passive, like a supplement or a hands-on care or, like a passive implements, like getting ready to work out, like have to foam roll before you squat. It's like, I mean, do you, like, is that something you have to, if you can't live without it, you're probably too reliant on it. And it's probably now like the positive effect it had is now creating a negative effect mentally in the mental space. Right. So we look at everything. That's why we, try and do everything active. The workouts and exercise I give you are very simple, right? They're basic. There's nothing crazy about them. They're not special. And, but again, it's just with a little bit of experience and a little bit of knowledge, and we just direct the path. Dude, thanks for letting me come on. I don't even know if I said that. I love talking about this stuff. My whole mission is to like educate and just like get the word out there of like a more positive outlook on pain and injury. And it's not a death sentence, and it probably never is.
And for me, like I am, what I try and do with anything that happens in my life, I think I'm a pretty positive person. Like that's kind of my mindset is normally I try to look for the positives, right? But there are times when I'm like strictly focused on this is bad, this is negative, right? So right when I hurt my back, I was very much so in the well, right? This is bad. Everything's going to end. Like this sucks. But then being able to speak with you and speak with other people. And I'm really lucky that I have this following. So I have people that message me, it's good and bad because everyone shares their opinion. And sometimes I'm like, yeah, your opinion's stupid. But like, so having so many people message me and say, hey, because like, I'm like, I think with anyone, when you have this problem, you're like, I'm the only person that's ever dealt with this, but it's like, I've had so many people message me, and then obviously you helping me, it's like, you've worked with hundreds of people, maybe even thousands, right? Like, what I'm going through, what I'm dealing with, but like, it's just like, it's almost like the ego in your head is like, no, but he has never seen what I am dealing with. Like, this is much, much worse, right? But like having people message me and be like, hey, like I actually had, it was funny. I had someone that has actually worked with you, and he was like, hey, I had something that he does CrossFit as well. And he's like, I had something that sounds very similar to what you're dealing with. I worked with CJ for a few weeks and now I'm back at it. He's like, I'm just encouraging you, like you will get through this. Right. And so like, I was just like, man, I'm really lucky that I have that, right? I have these people that are messaging me. So like, I'm really thankful that I have this platform because like I said, I try and focus on the positive. So what's the positive out of this situation? One, I've been able to meet you and I've been able to learn a lot more about this stuff. But then two, and I think an even bigger positive is that now, because I have these platforms, like my last YouTube video, so many people were just so happy to see me sharing that stuff, right? And like, I didn't, that was not my first thought. My first thought was like, I should no more videos. I'll wait until I'm better. And it's like
Right.
part of it's ego because I don't want people to see me be weak, right? Like it's not fun as a I don't want people to see that because like I want people to think
Right.
that I'm, and this is not super this is not super like becoming of me, but it's just true. Like I don't want people to see me when I'm being weak, right? So but now I have this platform and I've been able to share, the little bit in the video, which it really wasn't much, but now this podcast is going to come out. Like I'm really excited because I know there are going to be people out there that it's not like they have a strong stance on you shouldn't move if you get injured or whatever. It's just what they've heard is rest, ice,
Right. Ice.
like rise, put your legs up, whatever, you know what I mean? Like this. Yeah, exactly. And like, that's what people, they've heard it so many times that they're just like, that's what you're supposed to do. And they see someone doing something different and they might not be like, that's wrong, but they're going to think, I feel like that's not what he should be doing. Right. And so being able to share this stuff with so many people, I think is very, very important.
Yeah. Cool, man. Yeah, I agree. I agree 100%. That's like that's my mission. I just want to be able to reach the most people and and have a lot of fun doing it. So I wanted to like circle back to like the progressions, right? I think we kind of like tangented off of like how I see you moving forward, right? So, so John, we're just going to speak, hold on, I let my pup out. We have people come in the door. All right, go say hi. All right. So, his name is Duke. He's a chocolate lab. He's the best. So me and John started working together and he had a shift and he can't bend forward, right? Those are like his limitations, right? So the main thing we want to focus on, right, is being able to get upright. He couldn't stand and that was like our main focus initially, right? So there's not a lot of like specific things we would do there, right? I told him like, it's okay to stand, it's okay to work into very low amounts of pain, right? And so we're not like working into like 10 out of 10, like, like driving into pain, like punching yourself in the side or something, like make it hurt. We don't want to do that, right? But working into some amounts of pain, what it will help do is like increase our tolerance to these movement patterns because we're highly sensitive right now. So because of that sensitivity, because of the injury, because he probably had some form of tissue damage, we went over all that stuff on how it's not related to tissue damage directly, but when you have an acute response like that, you for sure have something, right? Whether it's like a muscle strain or a disc bulge or a herniation or whatever, right? We don't worry so much about that. We focus on the symptoms because a lot of those things can present similar. And he doesn't have any of our red flags, which is basically like these severe issues of like incontinence, numbness, severe 10 out of 10 excruciating pain. A lot of his pain was movement driven and positionally driven, meaning when his muscles would work to get to a position is when he would have pain. But when he was sitting pretty still, it was almost a zero, right? Like it like wasn't anything. You just you'll feel a lot of pressure probably, right? Like just like not getting comfortable and kind of irritant, right? So we had our call and we moved around a little bit and I was like, can you bend over? And he was like, absolutely not. I was like, okay, so we call that Flexion Intolerant, right? And there's, my school of thought is we want to start working into flexion as fast as we can because we don't want that to kind of set in, right? Because the longer you avoid a position, more likely you're not going to be able to reach that position, further down the road, right? And this can be for anything, right? For anyone that's like not 7 when they started CrossFit, squatting into the bottom of a squat's like not an easy thing.
It's still hard
year of CrossFit, right? It's still hard, right? Because you have ankle, limitations. Those ankle limitations came from not utilizing dorsiflexion for a long period of time. And obviously there's genetic components with all of that stuff. But when you don't do something for a long period of time, you're going to lose it, right? You don't use it, you lose it. A little 4-year-old virgin reference there, right? But it's very true, right? It's
true?
So true.
If you don't use it, you lose it.
So anyway, so when we're talking about pain, we want to think of the same thing, right? And again, we're not working into large amounts, we're working into low amounts, right? So John has given basically if it's 4 or 5 on a pain scale of 0 to 10 or less, it's probably safe, right? And if he feels comfortable doing it, he's not very fearful. So I'm like, okay, let's try and start working, flexing forward. I'm really uncomfortable with that. Okay, fine. We don't have to do that yet. That's totally fine. So what did we do? We sat him down and he flexed forward. And could he do it? Fine, right? Very low amount of pain, right? Why? Because there's less muscular requirement and there's less load on that tissue when you're sitting, and you have more contacts with the ground. Normally when you can touch the ground more, you have more ground, points of contact, the body responds just a little bit better, right? There's less force, there's less load, etc. You're under more control. So we started there, right? And so think of that as like the bottom of the ladder. Top of the ladder is for sure the devil beast, or whatever you call the movement, right? The beast maker. So which is a man maker, devil press was what her. So that's our goal, right? If we can get back to doing that, that's where we went. So I'm backwards. My screen is flipped. I don't know why it's flipped. I'm like, what's happening? So anyway, that's why, because I was on Zoom earlier and I had a background on in I had Star Wars as my background. It was flipped. So I'm like doing all this and I'm like trying to fix my headphones and I'm like backwards. I'm like, why is this happening? Got it. Okay. I was so confused. Anywho, and mirror. Wow. Okay. Much better. Okay. So if that's the top of the ladder, we're going to work our way down, right? Or the stairway to heaven, whatever you call it, right? So we work our way down, just like you learned how to snatch. What did you do day one? You didn't throw a barbell over your head or with 100 keys on it, right? No, you learned one, what was a squat? You learned two, what's a barbell? What is this? Yeah. Iron rod. What do I do with this? I throw it around, right? So
like
there's a progressions. Yeah, there's progressions to fitness and performance, and they're very similar to pain. And instead of letting your movement competence drive the performance, we don't really so much about movement competence, especially someone who's been doing it a long time. So I'm not worried exactly how good your squat looks or how good your hip hinge looks or anything like that. I just want you to do it. Even if it looks really ugly, like as far as like a movement biomechanics thing, we're not worried about that when it comes to pain, because it's probably not the reason you're in pain, because you've done a devil press probably a couple thousand since Wadapalooza released them last year, right? So with everybody else. And so we're not worried about that, right? We just want you to get in the patterns, because those patterns are basically a no-go for your nervous system right now. So we slowly build and slowly climb the ladder from very basic patterns. So whether that's like, you can lunge. Why can you lunge? It's like a half squat, but your torso is upright. There's no forward flexion. Your center of gravity is neutral, so it doesn't hurt your back at all. And I would assume that it was probably a 0 on this, maybe a 1 on the pain scale, right? Yeah. Probably just standing up when you actually stood up, that shift kind of came in, right? So, but you could lunge. Well, that's a great exercise, right? That's a great exercise in general. And it's something that you can do that starts the path, right? And then we did some upper body stuff that I know wouldn't hurt, right? It was like, we did some banded curls, like, it has dumbbells, but I don't want anything that would kind of like shift that weight forward just yet, right? So that's where we start. And then we slowly progress to the pattern. If our end goal is the devil press man maker, right? And loading heavy into hinging, right? Probably some form of, like, you have a D-ball as well, or sandbag. So probably something of that, right? Which is a very similar pattern. And that's our end goal. So we just work it down, and we have our starting point, and we just build basic movement patterns, and we let your pain response tell us how hard to push, when to back off, when to take a rest day. We do that with good constant communication in True Coach, which is what we use. Mm-hmm. And so that's like the path, right? How long is that going to take? I have no idea, right? Mm-hmm. I went through this February of last year of 19, and I was doing a partner workout with my marketing girl, and she's like 5'0", 100 pounds. And we had a partner deadlift, and it was terrible. And so I'm just like, I'm deadlifting, like, it was like 300. It wasn't heavy, but she's not very strong, but I'm just like this, and my back, like, I'd never done partner deadlifts. And, was my technique bad? Some people deadlift really weird and their back is okay, but it was a stimulus that my body wasn't ready for. Right. And then that's why I responded poorly. So, it took me, like a month to get back to training fully. And, but I was fine, right? What I do during that time, things that didn't hurt and things that only hurt just a little bit. Right. Mm-hmm. And so let my pain kind of drive my exercise selection. that's why we don't worry so much about that diagnosis, just your symptoms, because a lot of things can present the same way.
Mm-hmm. Yeah. And I think like a lot of people, I was like thinking about this, and I was having a conversation with my girlfriend on one of the walks that you programmed, which is, it's a new thing for me. I mean, I walk a lot normally, but like seeing it in a workout, I'm like, oh, okay. But I was like talking to her about why I think people have this thought of don't move, right? And I think a lot of people, especially a lot of people that follow me, they are either maybe just getting into moving and like working out, or they don't do that yet, right? They might be just starting to diet because they want to lose weight. And I think that a lot of people that they don't work out as much as us, like, I mean, I work out most days, right? So the thought of not moving, it just makes sense. Like, of course that wouldn't
Yes.
feel very, like, I wouldn't want to not move. But like if someone they normally don't move, they normally sit on the couch, they don't, like, for them working out is not a priority at all, which is fine. Like people can think what they want or do what they want. But if they get injured, their thought, yeah, I agree. But their thought is not going to be, I should move more, right? If you're already not moving much, they're going to think I should move less. And so like for me, I guess I kind of have that idea too. Like I'm not moving as much as I was before, but I'm still going to move, And I think that that's a big reason why so many people are like, you shouldn't move, because they don't really move that much in their everyday life anyways.
Right. Very much so. There's like a spectrum of the people I treat, right? Some people like, I focus on pain management with chronic pain patients, or I work with a high level athlete. And I view them as the same person on a spectrum, right? Here we have like the high level CrossFitter in pain. And then here we have like the chronic pain, very low level patient who isn't very into fitness or doesn't really do anything, and they're very sedentary. And usually their pain, if they're chronic, not like yours, right? But most of the time they're just continuing training, and we have to teach them to do a little bit, just make better decisions, and move a little bit less, but with a little bit more purpose. And then the ones that you hear that believe that you should rest, usually they are the ones that you're right. They don't have a fitness background, and they're fearful of movement. We call it kinesiophobia, and they're fearful of movement in their everyday life, right? Raking the leaves, picking up garbage, taking out the trash, whatever, right? That because they're going to get injured doing these things that, they've been demonized. Don't bend over. What? Don't bend. Okay. Don't bend over forever, right? Mm-hmm. Don't squat below parallel forever. Like what kind of toilet do you have?
Uh-huh.
Like, I mean, you ever traveled out of the country? They don't even have a toilet.
Yeah, I know.
They're in the ground. You know what I mean? So it's like, it is very true, right? Like the ones that like have this mindset of like, rest is the answer for something like that, probably don't have a lot of fitness background, right? So like you doing this stuff is very low level, right? And again, all we're trying to accomplish mainly for the next anywhere from like 3 to, I would say like 5 to 10 days is to maintain a good positive mental space during it. And you'll just see, and we're just like piecing things together just so you keep moving during this time. So we don't go into like a depressive state, and obviously not like a clinical depression, but like if we get down on ourselves and we start having these like negative thoughts, then we're going to start having the hormonal response, which will increase our neurological sensitivity, which will then increase our pain. Right. So that's why we do it almost right away. We want to start just doing something. It doesn't even matter. Like, what did we do the first day? We did push-ups, curls, and
planks,
a walk. Mm-hmm. Yeah. Right. And that was it. Right. And it's not because that was like the prescription. It was just because like, let's do something. And you're like, wow, that wasn't even that bad. And so now we have this like light bulb moment, and now we have an endorphin response, and now we have chemical improvements, and now we have a reduction in chemical pain response. Right. So it is the mentality. The brain controls all the chemicals that are going here, pituitary gland, adrenal glands, and all that kind of stuff, right? Controls how much cortisol and endorphins is being pumped into these regions. And if this region is already highly sensitive, we don't want to create a more of an inflammatory response because we're super, super nervous all the time. Right. So initially it just creates a good, positive mental space. Right. And that's why I like to do it right away. And then I like to start slowly working into painful positions, because we want to desensitize them. Right. That's like the best way to they're very sensitive to flexing over. We want to desensitize that, right? And we want to do it slow and controlled and progressive, and let the body tell us like, hey, that's too much, right? Could be a Wednesday and your pain is elevating. Okay, well, we take Thursday off. Maybe we even take the Friday off, right? We look at trends overall to let it drive how much we're doing. We might need a full rest day, right? That's fine, but like establishing like a 3-week response of nothing, or like writing out 3 weeks of like, hey, you're going to do these 3 weeks and you're going to see this progression, and then not talking to you the whole time. That would be both those would be relatively irresponsible from a clinical perspective.
Yeah, I think that I mean, that's huge. The mental aspect of it, because like if you're positive about the results, like I think that you kind of said this, but like the chances of you actually being successful are a lot higher, like we're not trying to sit here and say it's all in your mind, and like if you just think that you're gonna get better, you'll get better without doing anything. Like obviously that's not what we're saying, but if you're positive about it, like I really think that correlates to having a better result in the end.
Yeah, it does. We have a lot of good research to justify that.
Yeah.
When you have buy-in from the patient to your method, their outcomes improve. We have good, strong evidence to support that. Like if you could have the perfect prescription for someone, but if they're like, this quack doesn't know anything that he's saying, it's not going to help.
Mm-hmm.
It's like me. So I was like, I'm a great example of it, of like going in and get like like I've been dry needled before and cupped and all of this stuff, and like gone through like cryotherapy. And I'm like a super skeptic of all of it because the research and the true numbers behind it is all very poor. And I'm like, nothing, didn't do a thing. Right.
Mm-hmm.
But it didn't matter what was done to me at that point, because there was no way, even if it did, I wouldn't even let myself believe that it did. You know what I mean?
Yeah.
So when you have someone that's skeptic and that unbelieving of what's happening in front of them, their outcomes are going to be poor. Right.
Yeah.
Like when people are forced to go to therapy, their outcomes are just worse. When people voluntarily reach out to you, your outcomes are better, right? You are going, if you're positive about the situation, it's just going to improve.
Yeah. I had and I'm not sure if you might not want to talk about this, which I totally understand, but like I had a lot of people basically saying, you should go to a chiropractor. You should go to a chiropractor. And sure. I'm just going to share how I feel about that. And like the reason that I wasn't really super into that idea is because sure. I've had friends and family members that have gone into the chiropractors and they have acute pain, or maybe they're just trying to get adjusted, and they'll have one experience where they're like, wow, it was great. I felt so much better afterwards. Usually when they say that, it's a matter of time until they want to go back again and get it fixed, right? But mm-hmm. then I've also heard, and this is what scares me again, because I'm someone that worries a lot, and like that's just how I am. I've heard I went into the chiropractor and it made it so much worse. And like hearing that and the thought that could happen with my back, I was just like, I do not want that to happen at all. So I was just sure. like, I don't know, like the thought of having someone like that's not inside of my body understand like how this little movement hurts, but this one doesn't, like they don't know exactly what is going on, mm-hmm. moving me and like yanking on things. I was just like, I don't know about that. Like I just was sure. that was not something that interested me at all.
Sure. Yeah. And that's totally fine. Right. And, I don't, I have big aversions to people who make claims that are unsubstantiated. Right. Mm-hmm. So not a lot of chiropractors, some, claim this like, spinal alignment is all of like, this, you have to be perfectly aligned, and I can visually see it, my adjustments are going to realign you. Right. And we just have a lot of evidence that just doesn't happen like that. I'm not saying people don't go into a chiropractic office and feel better when they leave. They 100% do. But the whole first 45 minutes of this conversation was talking about all the other factors that play a role. A lot of narratives that we'll say medical rehab professionals, right? Because physical therapists do it too, right? The professions aren't much different as far as like what we're able to do. We're able to do pretty much the exact same thing, depending on your state, changes a little bit, but we do thrust manipulations. They call it adjustments. It's all about the narrative being used, right? Like you're doing something to someone. What are you telling them? What are you telling the patients that's happening, right? I've said more times on here that I'm just guiding you. Your body's getting better on your own. The issue with chiropractors and some physical therapists, and not all chiropractors, some of my main mentors from a clinical perspective are chiropractors.
Mm-hmm.
And it's all about the narrative and defining why you do what you do, right? And so when you're like, oh, your spine is shifted, that's why you're in pain. Well, so you were a great example, right? And you had a hip shift, very much a muscular thing. But if you walked in and like, oh, your spine's rotated this way, that's why you're in pain. Probably the reverse, like chicken or the egg. It's probably, your spine is shifted because you're in pain, right?
Mm-hmm.
Like, so you have this like muscle, this like hold. So is an adjustment at that time appropriate? Some think it is, some think it's not. Some people will respond really well, some people won't, right? But your reasoning behind needs to change, so it's like someone will say you have a subluxation. It's like, what does that even mean? Well, it's a type of basically this, like your spine is rotated and there's like the nerves aren't firing properly. And we've kind of disproven that kind of method, right? Or like someone says like your hips are shifted. And it's like, well, are they? Like, do we actually have like these innominate rotations of the pelvis that are happening? And we've proven that it just doesn't happen like that. So it's all about the narrative, right? And something I haven't talked about, the last statement on that definition said, described in terms of such damage. And what we call that is called you've heard of a placebo. You mentioned it earlier, right? The placebo effect. We have what's called a nocebo. Okay. And basically is a term or narrative that creates a negative thought process in the head. Like you have rotated hips, or you have a rotated spine, or your hips are uneven, or you have a muscle imbalance, or you're weak, or you're degenerative, right? Or you have a disc bulge, right? So while these terms might be accurate in their description of what is, do they have the weight that are they carrying the weight of what it sounds like, right? Like disc degeneration, right? You have a following of people that are like very much into weight loss. So a lot of them are going to see maybe increased younger ages of disc degeneration, right? Active people do. And people that are heavier do, right? That's just like it's just the way it is. And so, is that directly related to their pain? We've proven that it's not. And just like the wrinkles on your face have changed from when you were 12, they get worse, right?
Yeah.
And you look in the mirror and you're like, ugh,
yeah.
Go away. You're like,
Mm-hmm.
right? You want to like make it go away, right? So, yeah, but they don't hurt. Right? Disc degeneration, joint degeneration is like the wrinkles on the inside. They progress as we age, but they don't directly correlate to pain. And so a lot of these terms that we hear, right, that physical therapists and chiropractors use and rehab professionals use, physicians, DOs, athletic trainers, massage therapists, oh, you've got this like fascial trigger points and all these things. They just don't mean a lot. They don't have a lot of good evidential substantiation, and they don't have a lot of good logical reasoning behind them. And so we try not to use them. And we talk with you. That's why we try and avoid the diagnosis. You might have a disc bulge, you might have a muscle sprain or strain, and you might have a ligament sprain, of like somewhere in the pelvis, but it's not that important, right? So we try and avoid talking of these negative terms because they don't hold a lot of weight, and they can really influence someone's mental outlook on the situation, right? Because degeneration sounds terrible.
It sounds inevitable.
Like,
it sounds like you can't do anything about that.
Right, exactly. And we can't, but at the same time, it's
not that big of a deal.
It's irrelevant, right? It's not that important. It happens to everyone as they age, just in different severities, right? But the severity linked to pain has been proven that there's not one there.
So the thing that I, to kind of end this, because we've been talking for a while, but the thing that I just keep obviously coming back to is it's funny how similar rehabbing an injury or rehabbing whatever pain you might have is similar to maybe trying to lose weight or like improve your fitness. Like a lot of it comes down to obviously your mind, like obviously pain, it's going to go away eventually, or like the injury is going to heal. But like a lot of it comes down to one, being like patient with things and like understanding it's going to take a while. Two, knowledge, like having the knowledge about what's going on and how to maybe make things better or work on like the different exercises that we're doing. And then the third one is, what was the third one that it came into my head? But there's a lot of things that are very similar, and it's very interesting. It's like if oh yeah, it's the mindset of like being positive, right? So if you're trying to lose weight or you're trying to improve your fitness, if you are going into it being like, there's no way I can do this. It's a waste of my time. You're not
Right.
going to, and the same thing with like rehabbing a back or whatever it might be. Like, if you think there's nothing I can do to make this better, it just goes into everything, right? You're probably not going to be trying very hard during the workouts or really actually trying to get through it. You're probably really not going to be doing everything you need to do. But if your mindset is, I know that I can do this, with like people that are trying to lose weight, if they're like, I know I can do this, they're going to push through. It's like, oh, I'm really hungry. Okay, but I don't need to eat, right? That's something that people struggle with, is like they feel like if they're hungry, they have to eat. So if your mindset is, I can't lose weight, oh, I'm hungry. Well, I knew I was going to be hungry. I'm just going to eat, right? And so it's the same thing with that. It's very interesting how many things are like similar with these two seemingly completely different things.
Right.
Sweet, man. Well, I just want to say thank you so much for coming on. Obviously, I'll have everything linked for people to find you down in the description and the show notes and stuff like that. Is there anything else that you wanted to say before we signed out?
No, I don't think so, man. I think we said a lot for sure.
Yeah, no, I'm really excited for people to hear this. All right, dude. Well, thanks, man.
Yeah, this was good. This was good stuff, dude. I will see you in the